The skill set we have at eMerit is to help de-escalate conflict. By de-escalation, I mean to help you respond directly to the patient, if you know who the patient is, or to respond to the public at large. When a doctor calls us and says they received a negative review, typically, if they're a client, we will find it for them before they see it. So our task is to have a robot that goes out and checks the different sites, and we will be aware of a negative review. But regardless, the philosophy is the same. Typically, it's just listening to the story and making it right. It doesn't require rocket science to do that. But you've got to ask the right questions. So we suggest reach out to the patient and see whether you can make it right. That's going to solve many different problems. In fact, it'll solve most problems most of the time. In the plastic surgery world, the patient may not be happy with his or her subjective outcome. Sometimes it requires some hand-holding to say, be patient. I know that this is frustrating, but often over time, you'll like what you see if you will just be patient. But sometimes the patient will never be happy, and you may want to offer a revision procedure either at a reduced or at a discounted or at no price whatsoever. I mean, these are tools that can be used to make it right, to try and exceed the patient's expectations. Most patients don't expect this, most patients don't demand it. But to the extent you have someone who's unhappy enough to write on the internet about a negative experience, this is an opportunity to turn a negative into a positive. eMerit helps patients find the best doctors online and helps the best doctors be found online.